Our beloved subject, hormones. We in the medical profession are very concerned about the unregulated mushrooming clinics out there, even online, which will prescribe testosterone, whether you are a man or a woman, without proper evaluation. So let me talk about testosterone in men. As you know, it's the main sexual hormone in men, and to the shock of many men, they also have a little bit of estrogen in their system, but testosterone obviously is the dominant hormone. And there are normals for testosterone in men, and obviously if you have any symptoms of a low testosterone, you should be assessed. Then, after the proper evaluation, you have to make sure that the person doesn't have a contraindication to testosterone. What are the contraindications to testosterone treatment? Well, number one, if you had a history of clots in your lungs or in your legs, if you have severe sleep apnea, and so on, or you had a history of prostate cancer. Believe that we have made the proper evaluation, and this man is now subject to testosterone treatment. First, you have to make sure that he doesn't have a contraindication, and you also want to do a bone density, because one of the biological complications of low testosterone is development of osteoporosis, thinning of the bones. And I don't see this performed very often. What are the complications of testosterone treatment? Well, number one, question mark, development of prostate cancer, and that's still, the jury's still out. But again, you cannot do this online. You have to be seen by a physician who will do all this assessment. And, you know, I talked to you in the last 5 minutes about the assessment. This is a complicated issue. You cannot just say, oh, you have a low testosterone, or I think you have a low testosterone. Here is a prescription of testosterone. Goodbye. Okay? Please don't do. Second subject, testosterone treatment in women. Now, this is a very, very troubling development lately, because a lot of women out there are given very high doses of testosterone, which has not been found to be safe. Well, when you produce this estrogen in women treated with very high doses of testosterone, we are concerned what this might mean for their future risk of breast cancer and all the estrogen-dependent cancers. Will it produce cancer? We don't know. But you, as a scientist and as a physician, should be hard-pressed to give a medication that we don't know the long-term complications of.